Good morning. Welcome to the seventh installation of the Coffee and Conversation with the American Society of Colorectal Surgeons. I'm your host, Dr. Rob Amajoyi. I'm a colorectal surgeon here in Kansas City. Coffee and Conversation is an educational program designed to address physician and patient-centered experiences related to diversity, equity, inclusion, accessibility, and justice through casual but expert conversation between surgeons. These conversations are available for viewing to anyone with access to the American Society of Colorectal Surgeons YouTube channel. This programming will be brought to you every quarter. Today's episode is really a conversation on the achievements of one of my favorite colorectal surgeons, Dr. Lynn O'Connor, who has been demonstrating unmatched servant leadership and doing so much for the community. Joining me to discuss and celebrate her latest achievement is the illustrious and current president of the American Society of Colorectal Surgeons, Dr. Matthew Mutch, and Dr. Erin King-Mullins, who chairs the DEI for American Society of Colorectal Surgeons. She's also the president and owner of Colorectal Wellness Center in Atlanta, Georgia. Dr. Lynn O'Connor was selected as the first Black female colorectal surgeon for the New York Police Department. We will be discussing the impact of this position and her goals as the first Black female colorectal surgeon for the NYPD. Without further ado, let's bring in Mr. President, Dr. Mutch, to introduce Dr. O'Connor.
Well, Rob and Erin and Lynn, it's an honor to be here, and I thank you for the opportunity. This is a great occasion to be able to celebrate the accomplishments of Dr. Lynn O'Connor. She currently is the section chief of colon and rectal surgery at Mercy Medical Center and St. Joseph Hospital in New York. She has been committed to all the diseases in colon and rectal surgery, disparities and health equities within her community. She's actively involved in a national level in multiple sort of membership situations. She's a member of the American Society of Colorectal Surgeons, the American College of Surgeons, Society of Black Academic Surgeons, Society of Black Colorectal Surgeons, Women in Surgery, and has contributed significantly to the landscape of colorectal surgery. So it's a pleasure to Lynn to welcome you and to have you here. Tell us a little bit just about your background. Where did you grow up? Where were you raised? How did you even become interested in medicine?
Well, thank you much, Matthew, Erin, and Rob, for having me here. This is a wonderful platform, and I'm happy to be here to discuss this. I am a native New Yorker, born in Manhattan, raised in Queens, and I did all of my formal schooling in New York City. And then from there, I went to Rutgers University in New Brunswick, New Jersey, where I did my bachelor's degree in biology. And then I knew I wanted more of a global perspective of the world before I went to medical school. So I got my master's degree in public health at Yale. And then I went on to Temple, where I got my, in Philadelphia, Pennsylvania, where I got my medical degree. I did residency in Baltimore, Maryland. And then I did my fellowship in at Georgia Colorectal Surgery Associates.
So how did you become interested in medicine? I mean, what was the event or the occasion or the influence that sort of spurred you to this level?
Well, it's funny. I always knew I wanted to be a doctor from like the ripe old age of about 3. And the reason was because I really hated needles. So I wanted to find a better way to immunize children. And over the course of my years, the passion remained the same, but the reasons changed. And I absolutely got to the point of colorectal surgery because in my general surgery training, I realized I wanted to specialize in just one area, and I wanted to do it well. And I loved operating on the abdomen. So when you look at our specialty, there's such a plethora of diversity from anorectal cases to colorectal cases with diverticulosis, colon cancer, rectal cancer, and then you can do colonoscopies. So I love that diversity. And I've always been passionate about eating right, exercise, healthy living, those are some of the tenets that would mitigate your risk of colorectal cancer anyway. So marrying my profession with my passion was just a natural segue into colorectal surgery.
Awesome. It's always, it's always a pleasure to hear your colleagues tell their story, what's their why. So thank you for that. And I have to say, Lynn, you're a friend, right? We've been we've been at it for years. And even though we didn't meet until a little bit later into our specialties, you actually trained at the same fellowship program, where I trained. And so I feel like we're kindred spirits in so many ways on how we began this journey. And I would be remiss and not highlighting the fact that we are celebrating you during Black History Month. So thank you so much for all that you do. With that and a lot of the work that you and I have been in the trenches on for the past several years, let's talk a little bit about what's the importance of, membership of within ASCRS, the importance of our committee, the DEI, you and I were a part of that initial task force to get to spearhead this committee even being in existence. So what does it mean to you, how it ties into your mission, your education, everything that you stand for that you just, commented on?
Well, first off, I think overall membership in ASCRS has been key for my professional development. You look at all of the many committees I've been on, all the annual meetings. That's the one area where you can really get a lot of evidence-based medicine, cutting edge research that you bring back from your hospital and, bring back from the meeting to your hospitals, to your patient care, to your colleagues. So that in and of itself is huge. And I think the networking opportunities just being involved in ASCRS. And then you can also see that there's really a commitment to ASCRS, I think, for bringing up younger surgeons, for the diversity because of the DEI committee that we've been able to establish. I mean, that's key because we need a pipeline of African American physicians, underrepresented minorities, and for that commitment to be there and to understand the necessity of the importance of having representation on all levels, from leadership to committee chairs to invited lectureships. That's really key. And I've served on the Health and Economics Committee. I served on the Public Relations Committee, the Program Committee, the Outreach Committee, and the DEI Committee. So, and that's important. I'm the vice chair now of the Private Practice and Community Surgeons Committee. So our membership here, I think, is just key to our whole professional development. And having the DEI committee is just like the icing on the cherry on the top, because it really speaks to the society's commitment to making sure that we all have a voice and that we're all there and that we're seen and we're heard. And that's important.
Yeah. Watch out, Dr. Mutch, she's coming for your job.
Have at it. It's yours if you want it.
Erin,
so
I have a question before Dr. March. Which committee would you say I enjoyed the most for those of us listening?
That's hard. You know what? But I would have to say right now, I've enjoyed all of them. The DEI committee, obviously, hands down, is so important to me. But I've been learning a lot in the Private Practice and Community Surgeons Committee, serving as vice chair, because I realize that there's so much that's needed, and that's one of the things that we can do in our society is not only outreach to the academic surgeons, not out, but and the employed surgeons, but outreach to the private practice surgeons, the community surgeons, because that's where an opportunity to really grow the membership and to make sure that there are services that are there for the private practice physicians to feel included, to get the information. We've got rural surgeons, and we have people who kind of on islands. And if you can bring them into the fold and bring them into the society, there's so much support and services for them. So I think that's one area that we really need to grow. So it's been a nice challenge and it's been a nice change. And that's one of the ones that I've really enjoyed.
Dr.
So,
Martin?
yeah, no, Lynn, I mean, how we contribute to our communities, I think, is a tremendous sort of fundamental, building block of what we do as surgeons, particularly colorectal surgeons. We can do that whether it's in academics, whether it's in private practice. And that's one, I think, to me, one of the huge contributions that ASCRS has. We're a very good mix of all of those people. So how do you, in private practice, how did you get engaged to give back to your community? How did you gain that interest? How did you end up sort of where you are and the passion that you have for it?
I've always been interested in education and empowerment, and especially in, the communities that we serve. And a lot of my hospitals are in underserved areas. And with the health disparities that are out there, it's important for folks to understand the importance of colorectal cancer screening. For stage, when you look at it, African Americans are affected more so than any other race or ethnicity. We're 20% more likely to be diagnosed and 40% more likely to die. So it's key to be able to get that information out to the community. So I've spoken in churches, I've spoken in senior citizen centers, I've spoken in libraries, anywhere somebody can listen. I've actually developed a social media platform that has a wide presence to get that information out there. So I've just really been passionate about that all along in terms of making sure that because screening saves lives. And I've seen it. And I've also seen when patients come and they're a little too far gone. Especially now we're seeing it in younger and younger patients. So this information is key. And when you live amongst your family, your friends, your colleagues, and you see that there's a distrust of the medical system, and you see, rightly so, and you see how people may not have access to care, it just spurs you on to be able to get out there and do that community service, to let people know, and to make sure that that message gets out there. So I've really been very passionate about that, and that's something that I don't think I'll ever stop doing.
So you've done a lot of these community interaction outreach, platforms, different ways of getting your message out there. What is it about the New York Police Department that sort of spurred your interest and said, hey, well, this is really a direction that's important, that I believe in, that, needs a voice that you have to give?
Well, I was actually introduced to the NYPD by taking care of a lot of officers. And it was amazing how many officers were coming in, and they're sitting in the cars for a long time. So there's the hemorrhoid issue. They're not eating properly. So there's the constipation issue. And then there's so many other issues in terms of just screening. And we've got a young force. And there's a lot of, we also know that colorectal cancer is increasing in younger and younger patients. So I was approached to provide that service for the NYPD. And it's been such a meaningful, tremendous opportunity, because I have that platform again to be able to reach out to these officers and their wives and their husbands, their families, their significant others. We take care of 33,000 men and women on that force. And it's a great opportunity to be able to affect change, colorectal cancer screening, lots of programs, empowerment. And it also speaks to the importance of diversity in the NYPD for the officers to be able to have an opportunity to see a physician that looks like themselves. Because studies have shown when African American patients are afforded the opportunity to see a physician that looks like them, their overall care is improved. There's greater communication, there's greater trust, there's greater adherence to the outlined treatment plan, which leads to an overall improved outcome. So that's important. And it also speaks to, again, the commitment of the NYPD for diversity, and not only their uniform members, but in the people who take care of the uniform members.
Let me jump in for a second here. Lynn, I mean, you have a public health degree, right?
Yeah.
Yes. So that's a great way to put that degree to work, public health. And I like the fact that you speak at churches, and it's really, in fact, I have to tell you, when I was coming out, I had to I read your profile and I kind of copied some of your playbook. Speaking of churches is a very, very good way to reach so many different people at the same time that you will not do in the office. Because I mean, by the time you reach 400 people, 300 people in that sitting from the office, that would take you several months, right? So, so anyone that's not doing that, I recommend it. It really, really works. Erin, you had a question?
I did. Sorry. It's a very important question. Lynn, did they give you lights and sirens? I mean,
Of
listen, okay,
course.
I could never listen because I'm just speaking from personal experience. I'm not sure that I could ever. I know now Atlanta traffic's bad. It's not New York traffic. So I'm just feeling like some extra perks probably should have come with the position.
If we are if we are in the line of duty and we do need to make a call, if it's important, we can get lights and sirens.
Yes. Sorry, I just had to ask. You know, I had to ask.
You know what? They really are an amazing, group of people that they put their lives on the line every single day. I know there's lots of, propaganda around uh, bad apples, and all it takes is one bad apple to spoil a bunch. But it really is an amazing group of men and women that just every day put that uniform on to go out and do a service and to keep us safe. So to keep them safe and keep them healthy, it's a lot, and it's an honor. It's an honor, and it's a privilege to be able to do so.
Yeah, and I just want to piggyback real quick off of that. My sister is actually a police officer in Florida, and she's worked really hard. And I know, we're sometimes fearful when she calls us and there's something, really dangerous happening and she's on the road. She's actually worked her way up and she runs like the community service department and the public outreach department for them now, which is great because she's such a personal person. So again, that's kind of where my ties and wanting to really kind of promote this discussion, goes because we all have to work together. We're all here to in some ways, we as colorectal surgeons are here to protect and serve, right? So what better way to I know that was kind of trite, but anywho,
For them really is to primarily determine their fitness to duty,
yep.
to authorize, medical services for injuries that occur in the line of duties, to coordinate and follow their care. Obviously consultants in my area of expertise, and sometimes we even have to provide expert testimony. So there's a lot that goes into that, and I'm just in a really unique position to be able to provide what we have for those officers.
All right, moving on. Lynn, next question. I would say I do remember the time I did not even know what the word colorectal meant, and if you really think about it, folks, it's huge that she took this position. You have a huge community of police officers who's never heard of that word before and never understood what even the colon meant. So I really want to make sure we understand what this really means to take on that. A lot of responsibility, but way to shed a light to that specialty. So, what do you hope to accomplish? What should the NYPD officers, their family members, community expect from you? What do you think they really expect from you?
Well, one of the major things is one, their work is they spend a lot of time. It's grueling work. They're on their feet all the time. Various different areas within the police force. So making sure that they're fit for duty, and really paying attention to their health, coordinating their care. But more importantly, one of the things I also want to do is like I said, we have a young force. So it's important to establish screening programs, not only for colorectal health, but that's one of the main things that I'm interested in is their overall health, their overall well-being, quarterly webinars, lectures, implementing health programs for them. That's some of the things that they can definitely expect. And also the expertise in the colorectal field. We are seeing situations where younger and younger patients are coming down with advanced disease. It's even more advanced when they present. So having that avenue to be able to make sure that they're screened, to know the signs, to know the symptoms, to make sure that they're eating right, that they're exercising. I partnered with the nutritionists on the part of the NYPD to develop programs for them. So they can really expect like an overall health, a health overhaul for them.
So is there a tenure for this role then? Is there, you know, a finite time period, a term that you serve, or how does it work?
No, no, not at all. I can stay in this role as long as they'll have me. I can stay in the role.
Interesting.
And you know, one thing that just came to mind while you were speaking is, you know, I'm all about recruiting colorectal surgeons. So these families, their kids get to know what a colorectal surgeon is. They get to become interested in being a doctor, surgeon, colorectal surgeon. So it's a win-win.
I see the members' families, you know, at my offices. They'll bring some of some people bring their spouses in, other family members, if they have issues, and they'll say, yeah, I need to get my colonoscopy. So even if they're coming in for another issue, this is something that we discuss, and this is something that we will bring up, and I'll make sure that they are getting their screening.
Erin,
I mean, people need to be careful because we're everywhere. I mean, our influence of colorectal surgery is, I mean, you look at, you know, just sort of over my lifetime and, you know, the influence that we have on so many different levels, whether it's locally, nationally, is growing. And this is another incredible testament to that.
Yeah.
True. I mean, we are a small organization, but we're mighty. If you think about where we go, what we do, and who we can touch, and all of the information and the strength that's harnessed in the American Society of Colorectal Surgeons and the diversity that we have. That's why membership is so important as well.
The things nobody wants to talk about, but yet they'll talk to us.
Yes. Perfect strangers.
Yeah.
Erin, I think you have the next question.
Yeah, I just want to, you touched a few times about, you know, the impact of the colorectal cancer affecting in younger and younger patients. So what's kind of your goals on how to better educate and empower, you know, the community about this topic?
You know, one, making sure people understand that the screening age really is 45 now. And, you know, sometimes I think when you look at the African American community, it should be down to 40. But there are still so many primary care physicians, practitioners that do not know that we have lowered the screening age from 50 to 45. That in and of itself is key, because the number of cohort of people that we can screen and save just by simply lowering it is key. So getting that information out. And, you know, I do a lot of podcasts, social media, interviews with other folks to get that information out. I do a lot of Facebook Lives. I'm on Instagram, and also blog posts. So I do that as well as speaking, Erin, because I think it's important to make sure that as many people can hear it and tell. And even when I do colonoscopies and I've taken care of someone, I'll say, you know, make sure, do you have a brother? Do you have a sister? Do you have a family member? Make sure that you tell them to get screened. And also I tell them, find out your family history, because a lot of people don't know their family history. Families don't talk like that anymore. We're spread out. You know, you have the nuclear family, you know, the grandparents aren't with you. You have no idea where anyone is, and they're not talking. They're not discussing that. And the other thing that's important is the signs and the symptoms. I drill home the change in, you know, bowel habits, the rectal bleeding, the weight loss. You want to have so many times. We all hear it when they think it's a hemorrhoid and it's not. You know, they think the rectal bleeding is normal and it's not, and then they wait too long. And especially with younger people, because no one thinks a younger person is going to come down with colon cancer.
Yep.
You know, we can't stop talking about this. I think that's what I'm thinking. We have to keep talking and talking and talking. I mean, just today, I mean, the patient came in, oh, my primary care said, oh, he's age of 50. I mean, it's still happening.
Exactly.
People still don't know the age. I think we should be completely relentless, us colorectal surgeons, when it comes to this, because just one webinar alone can be enough to change somebody's life. The next question, obviously, is really about something that you hold very dear to you, which is you're one of the board member of the Society of Black Colorectal Surgeons. You are very integral to the creation of that society, and you talk about the importance of having a pipeline of Black physicians to help take care of our populace. There's a quote that he always says, you cannot be what you cannot see. So why is that important to you?
You know, it's so important to me because you look at the United States of America, there's 13.6% of the population is Black, where only 5.7% of the available physicians in the United States are Black. So odds are you're not seeing an African American physician. So that's key. And I remember the day, 2 days after I was sworn in, one of the I think it was one of the nurses at one of my hospitals came up to me and she gave me this huge, huge hug. And, you know, I gave her a hug back and she said, I have to thank you. And I said, why? She said, because she was struggling with her granddaughter. Her daughter had passed suddenly. So she was left with raising her granddaughter. And her granddaughter was kind of a little all over the place. And she told me that she sat and she was wrapped, just staring at the swearing in ceremony. And after she watched me, she said, I know what I want to do now. I know what I want to be.
Wow.
And, you know, there were tears in her eyes because, you know, she's lost her daughter. She's raising her granddaughter. She's trying the best that she can do to help guide her. And then for her to be able to see me on TV and see what I've been able to accomplish, she can see herself in me. So if other little boys and little girls can see themselves in me, that means that's huge. That's tremendous. So that means that's another person who's possibly in the pipeline, who's going to make a difference, who's going to serve their community, and who's going to affect the health of generations to come. So it's important. It's important for representation. It's important to be seen. It's important to be heard.
Very touching.
I'm so powerful story.
Powerful story.
Yeah. You know what? You don't realize you know, we're in our little bubbles and our little silos. So sometimes you don't really realize what effect you may have on somebody or what effect we have on our, you know, on our patients. You know, for us, we take out colons, we you know, we treat our patients, but we really touch people's lives. And I think every interaction is important. And that's, you know, that's one of the things we need to take with us. And remember, every interaction has things that we don't see later down the line.
Equally fact, yeah.
Yeah.
Well, I mean, and that really, Lynn, I think highlights sort of your commitment to what the work that you're doing is that, you know, yes, to be able to provide the care and service to, you know, our members of the law enforcement and the NYPD, but it even goes beyond them. It goes to their family members, to their children, and those are the things that we do every day when we interact with patients, when we do our community outreach, when we do all of the sort of, you know, things that we do. So huge congratulations to you for this honor and, you know, this commitment that you've made. That's outstanding.
Amazing.
And before we close out, do you have any final, like, kind of charge, you know, a call to action for, you know, everything that you just spoke so passionately about?
You know, I just think one of the most important things is that as hard as medicine gets sometimes and as burnt out as we get sometimes, we just have to remember the reasons why we got involved, what we need to do, the people that we're helping, making sure that we're working toward eliminating the disparities in healthcare so that there's access for everyone, because screening saves lives. If we can get that message out and if we can help each and every one of us to do our best, then that's what we need to do. And we need to increase that pipeline. We need to diversify our society. We need to diversify medicine, and we need to make sure that we support each other while we're doing that.
That's great. Dr. Mutch, you have any last words?
Thank you, Lynn. Thank you for everything that you do for your community, for our society. And, keep on doing it. We greatly appreciate it.
Thank you. Thank you all so much for this opportunity. This is an amazing time, and it's an amazing platform. And I'm very, very humbled to have been here. And thank you for inviting me as a guest.
Yeah, thank you, Lynn. I would say keep doing what you're doing. 11 years ago, I stumbled up on your website and like I said, I've copied some of your stuff, and you have no idea who else is copying your stuff. So just keep on trucking. What a fantastic discussion, guys. We can keep going all day. Thanks, Dr. Mutch. Thanks, Dr. King-Mullins and Dr. Connor. It's a pleasure. Once again, congratulations to you for this historic appointment and for all of your efforts and the work you've done over the years. For all the other colorectal surgeons out there, you can become chief somewhere too. Let's do this.
I want to say congratulations to you too, because, being the helm of the inaugural president of the Society of Black Colorectal Surgeons, that's a huge mantle that and that's a heavy crown that's on your head. And we have our president-elect down here. So, it takes a village, and I'm just very thankful to be part of this village. And,
we'd like to thank Dr. Mutch for being part of that inaugural meeting for the Society of Black Colorectal Surgeons, and all the support and that we've gotten from ASCRS. That means a lot to us. But a huge thanks to this production team for putting this webinar together. And as mentioned, the Coffee and Conversation programming will be brought to you quarterly. Be sure to check out our previous episodes on your YouTube channel, our YouTube channel. I'm your host, Dr. Rob Amajoyi. Until next time.